Hello, everyone. I'm Benny Watson. I am the Research and Clinical Translation Manager at TRI here in Brisbane, but I'm also the chair of the HTQ-led Consumer and Community Involvement in Research Alliance. And today I'm the MC of today's session. We're really, really proud to be launching the framework for consumer and community involvement in health research today. It's a new guide designed to help health researchers to embed meaningful consumer and community involvement across all the stages of the research cycle. And we're really grateful that so many people are taking time out of their busy days and having their lunch break with us to hear about the framework. So before we continue, just make sure I can, there we go. On behalf of the Alliance, I would like to acknowledge the traditional owners and custodianship of the lands that we meet today, pay deep respects to their ancestors and descendants who continue cultural, spiritual and connections to country, and we recognise their valuable contributions to the Australian and global society. Would also like to take a moment to give thanks to the lived experience for those who have the lived experience that share their stories and their partnerships with us to deliver quality research so that we can make the greatest impact for the community. Before we completely start, for those who don't know a lot about the Alliance, it's a collaborative of consumer partners, consumer and community involvement leads across the HTQ partnership, as well as other organisations within Queensland. And we come together really with a united purpose to support, but to also elevate consumer and community involvement. And we have this shared approach that we're doing things together to develop really strong relationships. We're sharing resources, our expertise and experiences so that we're, providing a benefit to the research ecosystems that we're part of. Today, we have a lovely lineup. We have Nancy Cloak, who is the Consumer and Community Lead at QIMA Berghofer, and she has also been the lead of the working group that has developed this framework. And we're also joined by fellow Alliance members, Anya Christopherson and Zephanie Tyak. So I would like to very much welcome everyone and thank our presenters ahead of time. And I'm going to hand over to Nancy.
Thank you so much, Benny. And thank you everyone for joining us today. It's wonderful to have you all here. As Benny said, I'm Dr. Nancy Cloak. I'm the Consumer and Community Involvement Lead from QIMA Berghofer, and I had the pleasure of leading the working group that has developed this framework. I'm sure you are all aware that consumer and community involvement in health research is no longer optional, it's essential. And it's been proven time and time again that meaningful involvement makes research stronger, more relevant, and more impactful. Its importance is also reflected in the growing expectations from funding bodies and ethics committees to have robust consumer involvement in their applications. At the first meeting of the CCI in Research Alliance on the 6th of March 2023, the group identified straight away a need for a framework to guide those conducting health research to embed meaningful consumer involvement into their work. So a framework project working group was formed consisting of consumers, researchers, and consumer engagement specialists like myself. This working group soon identified a crucial gap in resources. The current advice for researchers is that they should involve consumers at every stage of the research cycle. However, a specific guide on how to involve consumers meaningfully at each cycle of their research was missing. So the Alliance endorsed the creation of this framework for consumer and community involvement in health research. The aim of the framework to create a streamlined practical tool for anyone conducting health research that can guide them to embed good practice CCI in their work based on the cycle of a research project. While the Alliance is led by HTQ and its members are Queensland-based, we do hope that the framework will be used by anyone working in health research. So you don't have to work in a certain field or for a particular organisation or even in Queensland to be utilising this tool that we have developed. So it was most important to us that the framework be co-designed with the perspectives of consumers and the needs of researchers incorporated into its design. So our first draft was developed following a co-design workshop in November 2023, which brought together a group of more than 20 consumers, researchers, and CCI leads. The workshop was facilitated by Amanda Newbury, Managing Director of Articulus, and expert in community and stakeholder engagement standards that were developed by the International Association for Public Participation, or IAP2. The draft framework underwent multiple rounds of consultation and changes, both from the Alliance membership, but also through more widely through the health research community in Queensland, before we arrived on the content of this final version that we are launching to you today. And we are proud that this framework has been truly co-designed, considering feedback submissions from consumers and community, researchers, healthcare staff and clinicians, as well as consumer and healthcare organisations, all people with diverse backgrounds, demographics, and lived experiences. I'll now hand over to Anya Christopherson.
Thank you so much, Nancy. Hi, everyone. My name's Anya, and I have a lived experience of disability, but I've had the pleasure of being a co-researcher as a consumer over the last few years. I think just building on what Nancy was saying, one of the challenges that we really have in this space is how do we do co-design from the beginning? And I think that this framework was a really good example of that happening because it was all of us in a room together trying to solve the problems that we all had. And consumers are a part of identifying the need for even creating this in the first place. So, of course, as you're all aware, the importance of this framework is around elevating consumer and community voices in research. So research is publicly funded. How do we make sure that the public actually have a say in what we're doing and that our research is starting to translate into practice and have real impact for people in the community? So even though we did design this for researchers in mind, we wanted to make sure that it was a framework for all. And part of that is so it can aid in that power imbalance, so consumers have equal access to see what ways should we be working together. We speak a lot about partnership, but often it's very grey how that actually works and how we need to come together and research. But what we've put into this framework really tries to detail that out and also include consumer quotes. So one of the key reasons this was so important was because it actually provides that consistency. I'm sure everyone here understands how siloed health and research can be, but this is able to actually provide something that goes across all of the different research institutes and health services. So people like me as a consumer know what to expect, know how we should perform, and know how we should actually partner effectively. So I will now hand back to Nancy to actually talk us through this framework, but I would really encourage everyone to use it if they want to implement it more locally with specifics in their context, to look at implementation guides, but actually adopt this, use it, it's yours now, because that gives us the ability to work really, really well together. So Nancy, over to you.
Thanks, Anya. And it was wonderful working with you through this project to create this beautiful framework moving forward. Now we're just going to have a little look at the framework itself, actually. So whether you're looking to start a new project, apply for some funding, or strengthen the current consumer involvement efforts you have in your work, this framework's designed as a guide on how and when to involve consumers and community in your research. It also provides a minimum standard in CCI in research that health services and research organisations can look to for guidance and encourage their members to use. And again, this tool is not just for members of our Alliance or researchers that work for organisations that partner with HTQ. It can be used by anybody, anyone, who wants to embed good practice CCI in their research. So this is the opening page of the framework, and it has a reminder of the importance of CCI in research. The information also included has the purpose and content and intended users of this framework. It also introduces the research cycle that we use to create this framework, and this was adapted from the NHMRC's Keeping Research on Track 2. We chose this research cycle because it was co-designed with consumer input and for its accessible language. Page 2 of the framework importantly acknowledges the traditional owners and their custodianship of the lands and their connections to country, before it then recognises the Alliance members that were authors of the framework. And we are proud that this research has been created from the combined efforts of so many different organisations. There is also a link to the HTQ CCI resources webpage on this page with downloadable content to support your good practice consumer involvement in your research. On to page 3, this third page details the principles for effective, respectful, inclusive and authentic consumer and community involvement in your research. Please use these as a guide for your actions and behaviours when you are building relationships with consumers and deciding how you are going to work together in your research projects. The fourth page shows the research process as the 8-stage cycle and includes perspectives from experienced consumers for each stage, which I mentioned a moment ago. And then page 5 and 6 of the framework are a table format providing practical guidance on the goals of consumer involvement and how to meaningfully work with consumers at each stage of the research cycle. These tables also provide practical examples of activities you can use to facilitate consumer and community involvement in your research. And the final row of these tables emphasises the importance of building relationships, trust and communication with your consumer partners. This is vital for effective involvement and mutually beneficial working relationship when conducting research. And the final page contains a glossary of the language used throughout the document, but also terms that researchers can use when they are communicating consumer involvement, particularly in your funding applications and for ethics approval applications. Now I'd like to pass over to Dr. Stephanie Tyack.
Oh, thanks, Nancy. So yeah, I'm a researcher at the Australian Centre for Health Services Innovation, and I do a lot of research in the areas with hospitals and health services as well as communities. And I just thought I would reflect on just 1 or 2 projects where I think this framework would have been really useful. And when I actually looked back and thought, I wonder whether this has been captured in the framework, I was really pleasantly surprised because there really is so much in there. I'll just touch on one project. So one of the projects where I'm have really embedded consumers all the way through, and it reflects this whole cycle, is a fairly new project that we're doing with Charlotte Brown and also Dale Trevor, who are reflected in these photos, and they've agreed for me to use their photos in this presentation, but they have been instrumental not only in developing the project, but in the whole grant application. It's a project funded by the Medical Research Future Fund. They'll be involved in the data collection, in making sense of the data. So that cycle really reflects their involvement really well. And the whole aim of that project is to develop things that are really practical. So that's what consumers like them told us. They wanted information, support processes, and a website that could help guide their recovery after being a burn survivor, recovery after hospital, because that was recognised as being a huge gap. And then some other, in other work that I'm doing, which is really community focused, so the bridging study, that's a project where We're looking at connecting people in the community who have mental illness or ill health with a service provider. And so there's a program called Navicare that does that. And it's a project focused in rural central Queensland. And what we've done there is we've really had to work really hard to meet consumers and community where they're at. And I think this framework helps you to do that. And there was a slide earlier that really looks at the diversity of research activities that you can draw on. And then when I think about that, the bridging study, everything that we've used really is captured under those activities. So I think it can sort of help people to brainstorm what are the methods that could help me to meet community where they're at. And things that we embedded in there were people being in one site. We realised we really needed to be really informal. So we got a local cafe opened where people could just drop in during the day and they could just tell us what they thought might work best. We didn't record anything. We didn't do it as a formal research activity, but then they could do an interview later. And in another community, we did a much bigger event where people could just register. They didn't have to actually tell us that they wanted to come along. And we were overwhelmed with that. We called it a town hall, but it really aligns well with the activities that are shown in the research cycle earlier. So they're just a couple of examples. And so I guess the other way in which I really see this being as very useful, really to really get to the crux of the quality, really to provide high quality research, is combining a few things that are really nicely illustrated here. And I just love that the trauma-informed approach is incorporated in this, because I think that it can help researchers to brainstorm, how do I support consumers and community in the best possible way, not taking away the opportunity that they have to participate in the research, but really telling them information that helps them decide, is this the best thing for me? What are the risks that there could be? And then letting them make that decision, but having the support there at the same time. And I think this framework, as well as recognising the trauma-informed approach for consumers and community members, really important for researchers as well, because that's a huge gap, is actually understanding that researchers sometimes need support too. So I think that this framework, it can be just a reminder of that. Prioritising open communication. I think as researchers, we get very busy. Our consumers are also really busy people a lot of the time. So it's really nice that the framework reminds you to have this open communication for authentic relationships and partnerships to develop and be ongoing. And that sometimes means, making sure that we do things when we say we will, making sure we reimburse participants in a timely manner. And for me, I've learnt an enormous amount through chairing a consumer advisory group, and I try to be very open to say I don't get it right all the time, and my consumers are so good at reminding me what else can I do. So I think for all of us as researchers, we just need to keep reflecting on what works and what doesn't. And I think using this framework could be very helpful. A lot of my work is focused on the really practical side of things. So I think it's a really practical tool. So thanks very much.
Thank you, Stephanie, and of course Nancy and Anya as well for your thoughts around the framework and the guidance through the document itself, and hopefully setting the scene on how it came about, and thinking maybe already how maybe you'll be able to use it in your future. So thank you. Before we let you go, though, I want to introduce Sophie Munn from HTQ. She has got some news about the consumer and community involvement microgrants, and I will let her tell you all about it.
Well, thank you, Benny, and hi everyone. Thank you for having me here today. As Benny said, I'm Sophie Munn. I'm from Health Translation Queensland, and I'm really, really excited to be here today to introduce our refreshed CCI microgrants program, which does officially open today alongside the new CCI framework. So for those of you who might not know too much about it, it basically provides practical support for genuine consumer and community involvement in research. It helps to ensure that valuable consumer perspectives are integrated right from design stage through to implementation. And it also aims to foster that collaboration between health services, our universities, our research institutes, and of course, consumers. Yeah, we did have a bit of a pause for evaluation in 2024, and as a result of those learnings, we have improved the program, and you'll be pleased to know there is increased funding available, and we have streamlined the application process, so we hope it is a lot easier for you all to apply. But I especially want to highlight that the microgrants do now provide that $1,500 to support these early engagement activities. But most importantly, we are offering a $1,000 bonus for any applicants who complete an evaluation based on this new CCI framework that was discussed today. This bonus is only going to be available for the initial launch period, so the remainder of 2025. In order, like in terms of eligibility, we do ask that at least one HTQ academic partner and one HTQ health service partner is included in the application. Of course, though, we do and will always encourage broader collaboration. We just do ask that it is led by one of our partners. And if you are unsure about who our partners are, there is a full list available on the website. And of course, we do ask that you apply this new framework throughout your project as well anyway. And yeah, so I suppose, yeah, over time, we have seen some really inspiring projects funded through previous rounds. So we are really excited to see how this next wave of ideas continues to strengthen. But yeah, applications are open for October and they will close on the last day of the month. So this is a much shorter window. So we also do expect a lot of interest. So please know that if you're not successful this month, we do really encourage you to submit next month. And please do know that it will run from February to November each year. And yeah, they're a limited funding pool, but yeah, persistence and a strong application will definitely pay off. So I think I'll leave it there. You probably heard enough from me. If you do have any questions about the program or your eligibility, please don't hesitate to reach out to me. Our contact details are on the website and also on the application form. And yeah, good luck to everyone applying. And yeah, thank you for having me today. And I will hand back over.
Wonderful. Thank you, Sophie. So that is, I guess, a wrap from us for today, just to for the launch of the framework and the relaunch of the microgrants, and to give you some understanding of the process that we've gone through. So thank you so much for joining us and for listening. If you would like any information and of course a copy of the framework, you can go on to the this website here and you can download it, and that's also the location for the resources for some frequently asked questions, so you can get lots of information. Similarly for the microgrants. And because we've got quite a few people online today, we didn't think it was going to be workable to have a sort of a question answer time through the webinar. So if you do have any questions that you would like to send through to us, please use this consumers@Health Translation Queensland email, and you will be able to get to the team that way and ask your questions or to get some support. So thank you very, very much for joining us. Wonderful to have you. And thank you again to our presenters. And I hope our paths cross again soon. Thank you.